Hi there, welcome to this Tuesday's training on eating probiotic-rich foods, probiotics and prebiotics, and to talk to you a little bit more today about the benefits. My name is Ashley Anderson. I am a registered dietitian and personal trainer and owner of Move Fully Nourished. All right, so our agenda today, we are going to talk about the digestive tract. We are also going to talk a little bit about what probiotics and prebiotics are, some of the health benefits, sources, food sources of probiotics, as well as some supplemental sources, and then sources of prebiotics as well. We'll talk today about how to incorporate probiotic and prebiotic-rich foods during meal times as well. So the digestive system, let's start there. Your GI tract or your digestive system is comprised of the mouth, the esophagus, the stomach, the small intestine, the large intestine, and then the anus all the way down. The liver, the pancreas, and the gallbladder here are really auxiliary organs that help to facilitate the digestive process. And then bacteria in your GI tract, also called the gut flora or microbiome, help with that digestion. Bacteria in the small intestine, so we're looking at small intestine here, makes some of the enzymes that you need to digest carbohydrates. And your small intestine is what moves water from your bloodstream to your GI tract to help break down the food. So water is essential to the digestion process. And I talk to this with my one-on-one clients all the time, and why when they're dehydrated, they have a lack of digestion and absorption of nutrients. Your small intestine also absorbs water with other nutrients, and then in your large intestine, more water moves from your GI tract into your bloodstream. And then the bacteria in your large intestine, so this large intestine here, helps to break down the remaining nutrients and makes vitamins. Waste products of digestion includes parts of food that are still too large to become a stool. Okay, the bacteria in our gut. Your gut and the good bacteria can displace bad bacteria and influence overall health, metabolism, digestion, and body composition. We have over 50 different genera of bacteria and over 500 different species. That's a lot of bacteria in our bodies. So our bacteria is as important, if not more so, than the liver. And most people think that the liver is the only or that essential organ to help in the detoxification process. And while it is, the bacteria has a very large role in that as well. It can also help create B and K vitamins. So B vitamins for energy, K vitamins for bone mineral density and health in terms of coagulation of the blood, enhancing gastrointestinal motility and function, digestion and nutrient absorption, as we just discussed before, with water as well, and helps to metabolize other plant compounds and drugs like medications or supplements, helps to regulate blood flow. And what we're going to talk a little bit about, so before I was saying when you have plenty of good bacteria, this is when you don't have enough good bacteria. So what causes intestinal dysbiosis? Dysbiosis is really having more bad bacteria than good in the GI tract, which causes irritation, problems, and a whole gamut of things. So contributors include the long-term use of pharmaceuticals, most notably non-steroidal or anti-inflammatory drugs like NSAIDs, birth control, and corticosteroids. So I want to point this out and bring to your attention here. Many people think, oh, birth control is, helping obviously do its course in terms of preventing a pregnancy, but also other people will use it for regulation. Other women will use it for regulating their cycle. However, what we do know is that it greatly can affect the bacteria within the GI tract. So if you've been having gut issues your whole life and you've been on birth control forever and ever, years and years and years, it may be a time to talk to your doctor about making the switch to come off of birth control so we can see what your gut is capable of doing on its own. Same thing with corticosteroids and then NSAIDs here. So excessive sugar or refined carbohydrate consumption. This is a big one. I often hear my one-on-one coaching clients, especially when they come in or come to me in the very beginning, is excessive sugar consumption and addiction to sugar is because the bad bacteria is creating this mental pull on you to want more, because the more bad bacteria is the more infestation of bad bacteria, and the more the bad bacteria will grow. So excessive sugar, refined carbohydrate consumption, overeating, and inadequate fiber intake. So when you have a lack thereof, excessive alcohol consumption, although red wine in moderation seems to help improve gut in some studies, it still is in moderation. So we're talking about, a couple drinks, if that, per week. Okay, pathogenic bacteria. So infections from H. pylori, E. coli, which can compromise gut health for up to 3 years. If you've had a bacterial infection that is pathogenic, you need to make sure that you're taking care of that infection, because again, see here, 3 years. So we need to make sure that then after a proper recovery process happens with proper probiotics and prebiotics and the whole gamut of healing. And that occurs with supplementation there as well. Okay, parasites can cause dysbiosis, yeast infections, very common in women. Stress. I talk about this probably on every single presentation I do. Stress, acute or chronic, causes intestinal dysbiosis. When we are constantly stressed or fatigued from having so much anxiety and just feeling overwhelmed, it affects the bacteria, because what you think creates, again, a hormonal cascade of events. So I always tell my one-on-one coaching clients that where your thoughts go, energy flows, and this is a part of that equation. Okay, environmental contaminants, that's also a big one. What we breathe in our air, what we put on our skin, what we heat our food up in. This is, I have a whole presentation just on that topic alone. But to continue on with dysbiosis. So what are some of the results? Like why does this even matter? Why do we care about dysbiosis here? So you can see this poor little baby has got some eczema on the face, or rosacea or psoriasis. A leaky gut often goes along with conditions such as autism, type 1 diabetes, allergies, mental illnesses like depression and schizophrenia, skin inflammation such as acne, rosacea, and eczema, diminished insulin signaling, asthma. Okay, so let's go back to that. So you may think, oh, okay, what's the big deal? Well, look, a leaky gut, when you have more bad bacteria than good, and you don't properly digest your food and your nutrients because there is an invasion of a compromised gut, and again, that bad bacteria, look at what can happen condition-wise. So not things that you're wishing upon yourself or anyone here. So definitely something to consider as a underlying cause of some of these ailments. Okay, what are some symptoms of dysbiosis? And these are often what I hear from my one-on-one coaching clients when we first start working together. So symptoms of disturbed gut can show up outside the gut itself, manifesting as seemingly unrelated symptoms like joint pain, hear that one often, fibromyalgia, sleep disturbances, rheumatoid arthritis, fever, restless leg syndrome, that's another big one, anemia, skin irritation, fatigue, just feeling tired all the time, even when you're getting adequate sleep, night sweats, headache. Okay, so these are just to name a few of the symptoms that are experienced with dysbiosis. So let's talk a little bit about probiotics. What are probiotics? What are the benefit of them? And why are we talking about them today with gut permeability and dysbiosis? The term probiotic comes from the Latin or Greek word pro, before or forward, and bios, of life. So life promoting. It's kind of a nice word there. Live microorganisms is what probiotics are. So you can kind of see a couple different strains here, what that might look like on a bacterial slide and a microscope. Good bacteria that we can replenish through food and supplements is another definition of probiotics. They are also a live microbial food ingredient that, when ingested in sufficient quantities, exerts health benefits. They must be taken or eaten regularly in order to maintain their benefits, and most often created by fermentation. Fermentation, that's even a good topic just to discuss by itself, but fermentation is really the process of when you take, for example, when you're making sauerkraut, and you take cabbage and you cut it up and you put it in its own juices and you added some salt to it and you let it ferment, or you let it sit for a couple weeks, and then the fermentation process creates a probiotic. So when you are looking in the grocery store for a sauerkraut, you're looking to make sure that the only ingredients in the on the back are just the vegetable, so cabbage or whatever it is, and then salt, because when vinegar is added, the fermentation process no longer exists in this case. So we're really just looking for the own juices of the vegetable. Okay, fermentation helps to eliminate anti-nutrients. So what can be difficult to absorb in the GI tract is anti-nutrients. Soaked, sprouted, or fermented grains, seeds, and tubers disable those anti-nutrients. So it's all part of the process of making it easier to digest and absorb. Food is then easier to digest, has more minerals, and a greater amount of protein. So if you've ever seen like fermented bread, like an Ezekiel bread, that, or a sprouted grain bread, I should say, sprouted bread, that is, and it has more protein and again is easier to break down in the body. Okay, let's talk a little bit about prebiotics. So we just talked about pro. What are prebiotics? And I've got this little caricature here to demonstrate, a little Pac-Man image. They are non-living, non-digestible components, fiber-rich foods that help probiotics flourish. So they provide a steady, nutrient-rich diet to the probiotics. So if the probiotics here are the Pac-Man, the prebiotics are the fuel for the probiotics. So really they come pre, like before the probiotics. In order to be classified as a prebiotic, it cannot be broken down in the stomach or absorbed in the GI tract, is fermented by the gut microflora, and is selectively stimulates growth and or activity of intestinal bacteria associated with health and well-being. So those are some of the benefits and the differences. So again, pro versus pre. If we look back at the slide, we can see the probiotics. Pro is what eats the pre for the fuel to proliferate. You want to create more good bacteria in the gut, and the probiotics are what gives you that, what gives you the opportunity to create that healing process in the GI tract. Okay, what are some health benefits of probiotics? They protect your immune system. Your immune system, you've probably heard it time and time again, is your gut. Your immune system and your gut are one and the same. It's your second brain. It's really what helps your body take in nutrients, breaks food down, be able to send nutrients into the cells that need the energy. So it plays a major role. Breaks down vitamins and also ferments those fibers and carbohydrates. So that's a good thing. Helps to produce fatty acids that are important for inhibiting growth of harmful bacteria. So the probiotic again for the win. And consumption can shorten or reduce risk of infections, intestinal viruses, and control or reduce development of certain allergies. When we were in the height of the COVID pandemic, it was something that I was recommending to my clients to really make sure that we are looking at probiotic rich sources in order to maintain a healthy gut microbiota. Antidiarrheal effects, so creating stool regularity. I often have people come to me with constipation, or they think that 1 or 2 bowel movements per week is normal. 1 to 3 bowel movements per day is actually what's normal. So if you've had anything other than that, you have dysbiosis. There's something going on in your gut that's not functioning appropriately and needs to be corrected. Okay, and then alleviation of lactose intolerance. So many people now, especially as you get older, as you age, start to have irritation with lactose products like milk and dairy and yogurts and cheeses, but more so the ones that are higher in lactose like milk. Used to manage irritable bowel syndrome symptoms. And as someone who had irritable bowel for most of my life until adulthood, I can definitely speak praises to probiotics for myself. Some strains may also reduce the severity of microbe-induced gut inflammation and acute gastroenteritis, inflammatory bowel disease, and may reduce the risk of colorectal cancer. So again, big wins for probiotics here. So what are some sources, food sources? We start with food first. Fermented vegetables, like I was explaining before, sauerkraut, kimchi, pickles, beets, and carrots. Fermented fruits, chutneys like jams, green papaya, pickled jackfruit. So the things that are just a little bit on the lower end of the sugar side. Sometimes papaya is a little bit more. Yogurt, kefir, sour cream, buttermilk, plain, no added sugar with live and active cultures. Kombucha. So I often get asked, what the heck is kombucha? Or maybe it's becoming more familiar now. We brew our own homemade batch, but kombucha is made, it's a tea, but it's made with a live culture. So it's called a SCOBY. And that SCOBY then is what actually eats the sugar in the liquid and creates a probiotic as a result. Fermented condiments like homemade ketchup, radishes, salsas, pickled gingers, water kefir, coconut milk kefir. You can buy these at the store, usually found in the refrigerated sections. Homemade coconut milk or cashew yogurt. Mold enhanced cheeses like blue cheese is a source of probiotics. Beet kvass. This one is usually a mixture of like onions and beets and again, fermented. Natto, miso, tempeh, and tamari sauce. So these are forms of soybeans that have gone through the fermentation process. So what are some health benefits now of prebiotics? So prebiotics increase the absorption of calcium and magnesium. Very, very important for bone health as well as muscle health. Reduces duration, incidence, and symptoms of traveler's diarrhea. If you've traveled for work in the past, or if you've just traveled and had issues with digestion, given the food changes and the elevation changes, the prebiotics actually can help to subside those symptoms. Alleviates IBS symptoms, prevents specific allergies, reduces energy intake and markers of insulin resistance, improves body weight management, and may increase satiety and decrease appetite. May inhibit the growth of lesions, adenomas, carcinomas in the gut, and reduce risk of colorectal disease associated with increase in short-chain fatty acids like butyrate, which helps to improve laxation, decreases cancer risks, and helps to maintain a healthier gut barrier to the pathogens and other substances that may cause illnesses. So again, just in summary, these two go hand in hand. The prebiotics and the probiotics, they work together to really help create harmony within the gut. So what are some sources of prebiotics? Asparagus, avocado, banana, dandelion greens, especially more green bananas, eggplant, endives or radicchio, that lettuce, flax or flaxseed, ground flaxseed, garlic, leeks, and onions, honey, especially locally purchased, Jerusalem artichokes, or sometimes known as sunchokes, jicama, kefir, legumes, whole grains, oats, quinoa, barley, and rye, yogurts, yams, and resistant starch. So this would be cooled and parboiled rice. Tiger nuts, this one isn't as common. So tiger nuts, you can buy in a ground flour, you can buy in whole form. They kind of, they're actually one of the smallest, they're not actually a nut, they're actually a source of a carbohydrate, because as a resistant starch, that fits into that category. And it's also used in a lot of autoimmune cooking or AIP protocol, autoimmune protocol cooking, because it is not a nut and it is its own unique category. So anyways, if you're interested, look up tiger nuts and see what they are. They kind of have a sweet flavor to them. Very subtle. Cooked or cooled potatoes, cooked or cooled legumes, soaked well or sprouted, cooked well to make sure that you're reducing those anti-nutrients we discussed briefly before. But again, going back to the resistant starch, this is a big source of prebiotics, and so are green bananas. Green bananas are also a good form of resistant starch. And you can see some of these overlap. So while yogurt is a good source of probiotics, it's also a good source of prebiotics. And kefir has probiotics and also has prebiotics. So there are some that overlap here and can be a 2-for-1 deal. Okay, what are some recommendations that I would give you all? If you are healthy, aim for at least 2 servings of probiotic-rich foods each day. If you hope to prevent or alleviate a medical issue, you may need to increase the dose to 4 servings or more per day. So we're talking food. If you are a healthy individual, aim for 3 servings of prebiotic-rich foods per day. So this up here was probiotic. Now this is prebiotic. So the prebiotic sources is more like the vegetables and the yogurt, another thing we talked about. The probiotic sources were the fermented vegetables as well. If you have an immune compromised, or if you are an individual with a compromised immune system, you can develop actually infections from probiotic microbes. So be cautious if you're taking immunosuppressive drugs, if you have AIDS, if you are receiving radiation or chemotherapy, or if you are in the hospital. This is a really important kind of pause. And what I mean by that is just like in the population of, most people I would recommend probiotics for, but this would be a population that we would definitely hold off and heal the gut in other ways. Okay, supplementing. Between 3 to 7 billion live organisms for a starting dose. Each person is unique and dependent. I discuss this in detail with my one-on-one coaching clients, depending upon where they are with their gut health and what foods they consume on a regular basis. And then moving them up to really alleviate a specific health concern. And sometimes dependent upon the probiotic, which I'll talk a little bit more on following slides, dependent upon the type of probiotic, the CFUs are the colony forming units, which including the most beneficial strains like Bifidobacterium bifidum, Bifidobacterium longum, Bifidobacterium breve, Lactobacillus acidophilus, Lactobacillus rhamnosus, and then Lactobacillus bulgaricus. So those are some of the most important strains that have been well studied and well researched. But I would like to take a moment here to talk to you a little bit about one of my favorite probiotics, because as someone that has tried more than 20 different brands of probiotics in my lifetime, given my history of IBS and Hashimoto's, and really why I became passionate about becoming a dietitian to help people with their digestive issues and their autoimmune conditions. And when I discovered GutMate, it really changed everything for me. And so I really became fond of this company for several reasons, not only because they have so much research to back what they claim, they also are different than other probiotics out there. So I used to take like 50,000 CFUs and it just wasn't helping me. And what I realized was that all those other companies do not have a patented enteric coating, while GutMate Probiotics does. They have a patented enteric coating, which means that most other probiotics die when you get into the stomach acid, but GutMate delivers the probiotics along the entire GI tract because of that enteric coating, protects the probiotics from the acidity of the stomach. So it's really important that the probiotic has that, because otherwise you're just adding a bunch of probiotics, like you have 100 CFUs and maybe 5 get there. So it's a really important piece of this product, part of this product. Okay, so in the standard formula, there are 20 broad spectrum probiotic strains, so scientifically formulated with 20 central probiotic strains to target both the small and the large intestine, as well as the urogenital tract, and then 7 billion CFUs per microbe per roll. They're also circular, a little bit easier to swallow for some people rather than in pill form. The formulation provides both high strain count and optimal balance of CFU count for each strain. So this is directly from their site. If you pull up their website, you're going to see this. 60 easy to swallow micropearls per container, and then they are also room temperature stable. So very easy to travel with and very easy to take with you in terms of helping reduce traveler's diarrhea. Okay, intestinal adhesion. So what you need probiotics to do is you need to attach the intestinal cells, or probiotics must be able to adhere, and otherwise they get swept really along with other waste material. So they kind of get treated just as part of the crowd before they can really deliver any health benefits. So what you can see here is the attaching to this intestinal cells. So you've got the intestinal cell walls here and the villi here. The GutMate has been clinically documented to survive the passage through the GI tract, attach themselves to the intestinal cells through a specific mannose-dependent binding mechanism. And this is the main criteria for the probiotics to be active in the intestine. So it's another important part of this product. The GutMate probiotics are also clinically supported to reduce gut permeability, so the leaky gut syndrome. So they've done 13, or there has been 13,434 clinical studies with this specific bacteria, Lactobacillus paracilli, Lactobacillus plantarum, and supporting a healthy immune system. So clinical studies that have been done for these 2 bacteria strains, these 3, and then also to help break down dietary fibers into small chain fatty acids, which is really important for gut health and permeability there. So those are the clinical studies that have been done specifically. So the support here means that all these strains are within the 20 of the probiotic strains within the GutMate product. Okay, let's talk a little bit about oversupplementation. Is this possible? Well, in healthy individuals, side effects of overconsumption of probiotics will be minor, if at all, but those with compromised immune systems can result in complications like diarrhea, bloating, or nausea. So you really want to be careful. Check with your healthcare provider, check with your dietitian. If you're watching this and we're working one-on-one together, let's bring it up and have a conversation if we haven't already. If we are not working one-on-one together and you'd like to learn more about the Move Fully Nourished team and program that we have together, myself and my other dietitian, Rachel, we'd love to learn more about you, really what's going on with your health and how we can support you best to live your best life. Hope you all have a fantastic rest of your day. Thanks so much for joining. Let me know if you have any other questions.